Hey, good morning, everybody. My name is Dr. Patrick Flynn. Welcome to Saturday morning's quick tip this morning. I'm so excited to be with you. And we haven't had a quick tip in a little bit that way because I've been traveling all over the country from everything from hormone connection seminars to actually just even my anniversary in New York and everything. So it's been a wonderful time. I'm so glad to be back with you guys in studio today. So today, our favorite topic is actually hypertension. The reason why I call it a favorite topic is it's actually a very common thing. Okay, so we're going to go through this in great detail to give you a very different perspective of how I view high blood pressure, aka hypertension. Now remember, blood pressure issues are extremely common today. Millions upon millions of Americans itself deal with it, but all over the world. One of the things I've been asked about a lot, especially with certain politics things, people talk about, healthcare. And I literally get probably 10 messages a week. Okay, now once again, it doesn't seem like a lot considering the hundreds I get per day, but 10 messages a week or so asking about universal healthcare and what's my viewpoint on it and stuff like that. Well, I tell people that's not a healthcare question, that's a health insurance question. And if you look at stats across the whole world, blood pressure is an issue everywhere. Now, why? Because it doesn't matter if it's universal health care or it doesn't matter if it's paid here by yourself or private insurance or government insurance. The thinking is dramatically failed us. And that's why hypertension or any condition all over the world is actually very common. This is one of the most common conditions that are defined and used. If you look at one of the top reasons why people go to doctors in the United States, hypertension, aka high blood pressure, is one of the top 10. At one time used to be in the top, okay? But the thing is, it's universal across the whole world. Now, the one thing that I want to show you today is we're going to bounce back and forth from Mayo Clinic and their description of it, and then how I view it very differently, and how the Wellness Way approach comes up with a very different approach, but also a very different perspective on it, okay? So let's start there. Now, what I want to do is you can see today, I kind of don't have my PowerPoint totally up fully because I want to bounce back and forth from this to actually Mayo Clinic's website. See, that's the greatest thing today. I think the internet was once again the greatest invention when it came to healthcare because you can actually look up things, cross-reference. I always tell people, fact check everything I say. You know what I'm saying? Because once again, if this makes sense, now you can take the action steps needed to actually, not deal with these health conditions much longer. Now, let's start here when it comes to high blood pressure. High blood pressure is not a condition, it's not a disease, it shouldn't even be a diagnosis. Okay, let me say it again. It is not a condition. Do you see what I'm saying? Here's the perspective I want you to get. When you look at hypertension, all right, blood pressure, and we'll go through the measurements itself because that's all messed up in itself right there too. When you look at hypertension itself, what I want you guys to understand is this. It's the body's reaction. That's it. That's all it is. You say, Doc, what do you mean? Okay, it's no different. Let's say right now, some of you guys right now, I know are sitting at home. You're actually maybe still laying in bed. You're probably driving in the car that way. Well, let's say this. Any incident to where your body gets under stress. So let's just start with mental stress. Right now, your house catches on fire. Your blood pressure is going to go up. It's adapting to the stress. And believe it or not, if you lower your blood pressure, if you lower it, your ability to adapt to that stress, to even get blood flow to get it out of the house is diminished. It's reduced. So you can't adapt to the stress. And see, now I see all the guys going, hold the phone though, because here's where everybody goes. And you have to stop this because this is where medicine has messed you up. This is where your medical doctor has messed you up. This is where TV has messed you up, okay? Because they try to correlate directly with heart disease and stroke and things like that. Guys, I could tell you, I've had people that had their blood pressure at 270 over 140 and didn't have a stroke. Now you say, Doc, do you want to leave it there? No, but this concept that your blood pressure raises up so quickly and actually you have a stroke, if that happens to you, you were sick a long time ago. But you're saying? Because your artery was that weakened that all of a sudden you actually have blood pressure go up and you have a stroke. Girl, man, you've been sick for many years and your arterial system was destroyed by, I'll show you why in a couple minutes. But the idea is, so the blood pressure itself does not cause a problem. Let me say that again. Blood pressure itself does not cause a problem because I don't care if it's your 3-year-old child in the house or if it's your 80-year-old grandma in the house. If that house catches on fire, everybody's blood pressure is going up. Now, the chance of grandma or grandpa dying because they have weak vessels is higher than the 3-year-old or even yourself maybe at 40 years old. But we have to get this concept first that blood pressure is not bad. It's never meant to be bad. Heck, do this. We're going to get into this in detail. If we look, for example, if we sit, if we stand, or if we lie down, blood pressure values are dramatically different by even 20 points. See, so this concept, doctors have beat into you the high pressure causes. No. The next time they tell you high blood pressure causes something, you realize that they're ridiculous in their thinking. So let's give you a different way of thinking about this now that I ranted about that for about 2 minutes that way, okay? So number one, blood pressure is nothing more than your body's adaptation of stress, period. That's all it is. Any stressful event you have, from a fight with your husband, to a bad food, to a pebble in your shoe. Imagine this, guys. Brandon's hanging out with me. Good morning, Brandon.
Morning.
My nephew and him and I were just, having some good time this morning, chatting about stuff that way. And let's say all of a sudden, I accidentally step on his toe. It's going to hurt. His blood pressure is going to go up. I don't sit there and go, Brandon, here's a medication to lower it. No, the damage to his body has to get blood flow to that area because there was damage, okay? So the concept of blood pressure, here, blood pressure elevating on the basis of adapting to stress is never bad. Let me say it again. Blood pressure, when it's adapting to a stress, is never bad. I don't care if it jumps up to 180 over 100. It's never bad. Now, where it can turn out to be bad is when a person has damage, and we're going to get into that. See, because I already see some of you guys, actually, because you've been programmed. You've been programmed wrong your whole life. Do you understand? Now, it's kind of funny, so let's go to the next part. Number one, actually. Common does not mean normal. Now, what do I mean? I can actually tell you some things are going to happen, things recently happened. It's going to change the direction of some of the things that we're doing with some of, let's say, the book, okay? And one of the big themes in the book is common does not mean normal. Now, let me explain why. Conditions and things are so common that we think they're normal. Actually, let's go right to Mayo Clinic's website, okay? So all I have to do is type in high blood pressure Mayo Clinic, and you can follow me around right here, okay? If you look, for example, this, high blood pressure. High blood pressure is a common condition in which long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Well, there are some partial truths in there, but the idea is this. I do love this. First of all, a common condition. What does that mean? Common does not mean normal. Okay, common does not mean normal. Just because a young lady has PMS does not make it normal. I do this all over the world. I'll say, is PMS normal? The majority of women say yes. But see, the reason they say yes is because it's such a common condition that they accept it as normal. No. It's called premenstrual syndrome for a reason. Blood pressure is nothing more than your adaptation to stress. Now, I do like this part of it. I do like this part of the definition, in which long-term force of blood against arterial walls. There's the key. Long term. That's why if you look, the number one reason people go into the doctor in elderly adults is heart issues, especially deal with blood pressure. Because why? Here, let's start here. Blood pressure, and I'll give you to the end, we're going to wind back there. Blood pressure is only a major issue if it spikes extremely fast and you have some arterial damage. Once again, if you have some arterial damage, it's going to blow out, and it can even blow an artery. But it's not based on the blood pressure. It's based on the fact that you have been sick for a long period of time. Now, once again, let me give you another example. See, the body knows what it's doing. The body doesn't make mistakes. You do. And it's got to adapt to your mistakes. Let me give you an example. This morning, here in Green Bay, I walked out in the morning. I don't mind the chilly weather, but it was 30 degrees with 25 real feel, okay? I like short sleeves. Everybody makes fun of me because I don't really wear long sleeves that much, and I like wearing my little vest that way. But I walked outside, I could tell it was cold. By nature, if I stayed outside with just this t-shirt for, let's say, half an hour, the blood is going to pool towards my core, okay? Was that stupid? No. The body said, listen, I don't really care about your fingers and toes if your core is actually lacking blood or lowers its temperature. So it pools that blood towards that core. That wasn't a dumb mistake the body made. I made the mistake of going out in 25-degree weather with a short sleeve shirt. Do you see what I'm saying? Now, If I'm sick, once again, and I have problems with my circulation already, that can affect me fingers and toes where I could lose them. It doesn't mean the body made a mistake. See, the whole purpose of blood pressure, there's a lot of stressors out there. I mean, my goodness, I can give you a perfect example where I know a young lady has mold at an extremely high level and her blood pressure skyrockets. Yes, dizziness, fainting, and stuff like that can come from it, okay? But the body's adapting to those stressors that go there. Now, if she was older, if she was 60, 70, 80 years old, and now she's degenerated and her blood vessels are very weak and thin, that kind of blood pressure could burst it, and that's what everybody focuses on. See, and they fear you. See, that's the bad part. If you don't, for example, understand that unless you have arterial damage, blood pressure is not that big issue. Yes, you can actually have some ischemic and dizziness and lightheaded and feel woozy. That's fine. But what happens is they always talk about, well, if your blood pressure's high, I mean, they literally take teenagers now and they have them on blood pressure medication. That is ridiculous. And on top of it, here's what happens. Here's the coolest thing about blood pressure. If blood pressure is an adaptation of stress, and all you do is lower the blood pressure, you don't allow your body to actually adapt to that stress, or you don't know if you're still under stress. Do you see what I'm saying? And see, because you don't have to be under mental stress for your blood pressure to go up. Like I said, you can be eating a bad food. You can have pain. You can actually have, inflammation. You can actually have an infection. And your blood pressure jumping up is just saying, hey guys, something is trying to adapt here. Don't just lower it because they've convinced you that high blood pressure automatically turns into heart disease. That's not true. Actually, the funny part is this, it's a long-term force. Long-term. But I will even disagree with this. You can have long-term pressure, and once again, doesn't mean you're going to have a stroke. On the flip side, if you're having long-term pressure, that means your body's constantly under stress. And just to lower the blood pressure is a very bad idea. What you need to do is what? Find the stressors, find the inflammation that has to deal with all those things that way. So as we kind of go on, and actually it's kind of funny, they automatically turn into the symptoms of blood pressure, when to see a doctor. Now it's kind of funny. They talk about that the average high risk blood pressure goes from 18 to 39. See, we're getting sicker and sicker. We're getting sicker and sicker. The age of all conditions, which once again, blood pressure to me is not a condition. Blood pressure to me is an adaptation. But once again, people are getting more stressed out, more inflamed, more problems ever in history. So the age group of actually getting this is actually come down dramatically. That's why you can even see teenagers on high blood pressure medication today. Okay? So, Brandon, I didn't realize I got so intense about it because the thinking that way. I didn't say hi to all the people that are on there.
50 people.
Hello, everybody that popped on this morning. And for you guys that do not know or do not remember, today we are actually having the giveaway. As soon as we are done here, Brandon actually is going to bring over the box with all the names in for all you guys that shared it. Okay, and we're going to actually pull out the hormone test that we're going to give away today. Once again, for you guys that watch mine and Christy's bedroom series talk, and also who shared the other video that way, you got put into a drawing, and we're going to pull it out today, and we're going to see who wins it that way. So it's kind of exciting that way. Brandon was putting all the names in this morning that way, kind of reference them. There was a bunch of you guys. Thank you so much. We appreciate it. So, hello, everybody. Good morning. Everybody's kicking on there right now. Fancy Nancy's even on this morning. So here we go. So as we're kind of going through all of the aspects of blood pressure and what we're doing here, what I want to kind of do as we go through here is this. Remember, common does not mean normal. Always remember this. Common does not mean normal. Okay? Do not accept common as normal. Do not accept that it's common to put people on blood pressure medication and think it's normal. Here, I know this is so basic, but I'm surprised that people never think about this even though they know this. If all of a sudden your blood pressure is, and here's one, guys, they're going to continue to lower the values, okay? Because here's what happens. 128 over 80 is kind of standard that way, and then we get in that next. But what they've done now is they're even making 120 or 80 kind of pre-hypertension. I love that, okay? It's just like cholesterol levels. Cholesterol levels have dropped dramatically as they want to actually medicate more people that way. Now, here's what happens. The 120 over 80, for example, doesn't apply to like my wife, okay? Because why? It doesn't even apply to me because my blood pressure has never even been that elevated that way, okay? Because I think that's elevated. Yet I know people that their normal blood pressure is about 130 over 85, okay? And we're going to get over what each value means. So now, let's do this, okay? Let's go back to here. So remember, common does not mean normal. But number two, average does not mean normal. Okay, 120 over 80 is not your normal blood pressure. And even by statistics, as they go 121 over 81 is not pre-hypertension or actually hypertension that way. Let me give you a dramatic example. I can show you men and women where their blood pressure is like 90/70, and that's their normal. There's nothing wrong with that. See, what they do in medical stats, what they do is this. They take a pool of people, okay, and they'll take thousands and thousands of people over the course of time, and they'll say the average blood pressure is 120/80. And it doesn't distinguish between men or women, doesn't distinguish between cultures, doesn't distinguish between size. They say the average is 120/80. But I love how they convert average to normal. So then when they take a blood pressure, say you're abnormal. You're not abnormal. The only way you can ever really figure out blood pressure is get your body into a very low inflammatory state and then do what? Continually monitor it on a regular basis. Heck, do you understand there actually is a diagnosis called white coat syndrome? That means by showing up to the doctor, your blood pressure automatically does what? Automatically goes up. Because why? Because you're nervous as heck walking into the doctor. A lot of people are scared, and so what they do is their blood pressure naturally goes up. Because why? It's a stress, okay? So do not confuse that average with normal, okay? There is no such thing as normal blood pressure. You have to actually do this. Now, I know what my blood pressure roughly is because I've been taking it for a long period of time, and I keep my inflammation way down, and so it stays very consistent, okay? Now, Durham, if this room catches on fire and Brandon and I hightail out of here and I measure my diastolic and systolic levels that way, guess what happens? My blood pressure may jump up to 160/100. Because why? I was under stress. My body said, get the heck out of here. All the hormones change. All the things change dramatically. The angiotensin enzyme changed that way. And so now, but guess what? When I adapt to that stress and I go sit in my car, guess what happens? My blood pressure will start to go back to normal. See, blood pressure is an adaptation. Now, here's where the scariness and the fear that doctors put into. Let's say I was a very sick individual. Let's say, for example, I ate horrible my whole life. Let's say I took a bunch of drugs, which are poisons. Let's say I do all the things wrong, and now my arterial system is very weak. That my arteries start to do what? Thin out, okay? They start to become very thin. Now, all of a sudden, I get stressed out, and I go to run, and all of a sudden, the arteries can't handle the blood pressure going up. See, it didn't start with blood pressure, guys. This whole concept that blood pressure causes bad arteries is actually ridiculous, okay? It doesn't cause bad arteries. Inflammation causes bad arteries all the time. And because we're becoming so inflamed, people's blood pressure jumps up. They're seeing bad reactions and medical conditions based on a younger age that way, okay? So just understand, it's a different perspective that way. So you say, well, doc, what's kind of catch-22? Because you don't know if you're inflamed. Well, that's why you got to find a doctor that does that. Thank God I know a group of doctors, Brandon, that continually actually monitor inflammation and get your body back to normal, all right? So now, let's go here. So remember, average does not mean normal. It's a big thing. Now, it's kind of funny. Let's go back to Mayo Clinic, because I do find this funny. I do find this funny. Okay, here's the thing. This is the part that I absolutely love. Okay, now you're talking Mayo Clinic, the greatest diagnostic place in the world. Now, what do I mean by diagnostic? They're better at finding diseases and fires, as I call them, in the house than anybody on the planet. They're number one. Heck, I'm going to be over there on Thursday, which reminds me, I will be in Thursday speaking at Rochester, the Hormone Connection, over in that area that way. Put it in the comments that way. Thank you, Brandon. Okay, but here's what happens this. I love this. There's two types of high blood pressure. Number one, primary essential high blood pressure. Let's see how they define it, okay? For most adults, think of this, for most adults, here's the coolest thing, are diagnosed with primary hypertension. There's no identifiable cause of high blood pressure. Let me say again, there's no identifiable cause. Why? This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years, which means because our whole medical system is trained in a disease model, which means you have this condition that's measurable, they're like, well, if people are just under stress and their blood pressure goes up, we don't know why. And that's the majority of people out there. That's their diagnosis. They don't know why, but because we just think it's going to turn into stroke and everything like that, let's just lower it. I'm not joking, guys. This is the thinking that dominates most healthcare. And so when people come in and they say, Doc, my doctor said I had to be on medication. I'm like, I don't care what your doctor said. I don't. Do you say? Because he has no idea why your blood pressure jumped up in the first place. You know what I'm saying? I can honestly tell you that this literally happened. So a lot of people hear my example of, I'll talk about, if I step on your toe, your heart rate goes up. I can honestly tell you, okay, that I literally had a woman come in for blood pressure issues. No joke, blood pressure issues. And the first visit, okay, that I took care of her, I didn't have any blood work back, any food tests, anything that way. But we did take some x-rays, and she actually had a chronic ankle problem. A chronic ankle problem. So I took an x-ray on it, saw that we could do a little work on it. That day, I worked on it. That day, okay? After good analysis of it that way, we took care of the ankle, we adjusted it. Guess what happened the next day to her blood pressure? It dropped dramatically. It dropped dramatically. Because once again, if I throw a pebble in your shoe and you walk around on it all day and there's pain and stuff in there, your blood pressure starts to go up. So it's kind of funny. Now, when I got our foods back, got everything's back, yes, she became a very healthy woman. She's still with us today. But literally, that's where my example of if I smash your big toe, what happens to your heart rate? It goes up. What happens to your blood pressure? It goes up. That's where I created that example from, because I literally had a woman have an ankle problem. I took care of it. She came in for blood pressure, and I wanted to look at all her inflammatory markers, but it was one of their biggest things. See, that's why when you look at, there's no identifiable cause of high blood pressure in most blood pressure cases, because they're not looking at the right things. But boy, they have no problem if you're above 120 or 80 to put you on multiple medications to try to lower it, okay? Now, secondary hypertension. Some people, now look at primary, no idea. So think about this, guys. People are giving you medications with no clue why they're doing it. They're just reacting to your body's normal response. Let me say this. See, coming from this perspective, we know the body's adapting to some stressor. They don't think that way. They're not investigating to it that way. They're just like, here, we're going to react to it because it causes heart disease. That is a big lie. It doesn't cause heart disease. You know what I'm saying? The chronic inflammation that you've been doing to your life causes heart disease, which in secondary causes your blood pressure to go up, okay? In some people, having high blood pressure caused by underlying conditions. Once again, what are they? Sleep apnea, kidney problems, adrenal tumors, thyroid problems, certain congenital problems, okay? Illegal drugs. Guess what else is there? Birth control pills. Birth control pills. It's one of the major side effects. Medications cause a lot of high blood pressure. Why? Medications itself is a toxin. Does anybody know what the definition of medication is? Brandon, you better know this. What's the definition of medication? He's giving me that look. Okay? The definition of medication is a non-lethal dose of a lethal substance. He knew it. A non-lethal dose of a lethal substance. Medication itself can actually raise your blood pressure. Birth control pills, it's one of the major side effects. It's why if women actually smoke and add birth control together, their rate of stroke and heart disease dramatically increases. Okay? Because you don't want to smoke and you don't want to take birth control at the same time because there's major arterial damage, blood pressure damage, and it affects the heart. Okay? And once again, so a lot of the medications, there's so many times that I actually look at people's forms or a doctor's do and they go, Doc, I have high blood pressure. Yeah, because you're doing this. Your body's under stress. You're doing this. You're doing these things that way. And as you start to walk them backwards, that's where some of the reversals come in that way. So I kind of find that funny. The majority of hypertension, they just say, I don't know, but we're going to lower it. Remember, your body doesn't make mistakes. You do. Let me say it again. Your body doesn't make mistakes. You do. Your body responds no different, like once again, if you just popped on, it's 25 degrees here in Green Bay today. If I walk outside like my t-shirt like I did and stuff like that, I can already feel my body changing. Okay, if I stay out there long enough, it's going to actually pull all my blood to my core and pull blood away from my fingers and toes. My body didn't make a mistake. I did. I'm not out there with enough clothes on, okay? But I'm not going to blame my body and say, listen, I'm going to take a medication that increases circulation. No, put a freaking shirt on. You know what I'm saying? I know Brandon's back here laughing. He's in his early 20s that way, and he's been listening to me since he was a little boy. And it's kind of funny to him. This is kind of basic. You know what I'm saying? But it's not basic out there. This is more, it's uncommonly basic that way. So here we go. Risk factors. I love this one. Age, race, family history, okay? No, no, family history doesn't determine your blood pressure. The only thing that determines your blood pressure from family history is if mom and grandma and everybody feeds you horribly and you eat the same bad things that stress out your body, okay? I love how it's like, guys, tell me how this, I always love to say, I tell doctors, tell me how family history, with the exception of bad habits, because they see, when they say family history, everybody thinks genes. Everybody thinks my genetic pool. No, your genetic habits that have led to it that way, all right? Overweight, I don't disagree with that one. Not being physically active, I agree with that one incredibly. Do you understand? And remember, you need to be physically active. It's very vasodilating that way. Now, on the flip side, if you push your body excessively, once again, you can raise your blood pressure. Tobacco. Now, here is the greatest fallacy. If you haven't listened to one thing I've said, here is a key. And actually, Dr. Andrew McGuire has given the best presentation on the planet on this. So I'm going to go back to my PowerPoint right here. And point number 3. Number 1, you need more salt. One of the major causes of actual high blood pressure is you do not have enough salt. You may have some very, iodized processed chemical cyanide-based salt, but you don't have real salt. Our favorite is Celtic, okay? Because what happens in the whole angiotensin system, which a lot of your medications are, when you actually reduce salt, your aldosterone goes crazy in your kidneys and your blood pressure dramatically changes. So remember, when you look at the fact that, listen, this whole concept of lowering your salt has caused more high blood pressure than anything that way. Do you see? Because the majority of your purple umbrella salt that you guys have at your restaurants, at your home, is actually just a big old chemical mess. It really is. Dr. Andrew McGuire did a whole quick tip just on salt alone. We'll put the link, Brandon will pull the link up. Once again, one of our amazing doc from, he just obsesses about salt. Once again, actually we even call him our salt expert that way. If you do not have enough salt, you will have high blood pressure, period. We will show you, Dr. Andrew will show you the physiology and biochemistry behind it. We'll directly show you what happens when you don't have enough salt. And majority of people do not get enough salt in their diet. By far, guys, water is the most important nutrient. No one disagrees with that. Salt is number 2. Salt is number 2, by far. Actually, magnesium is number 3. But the idea is this. You do not have enough sodium, your blood pressure will skyrocket that way. And the majority of people have been fed a very damaging substance that we call salt today, and our body is very salt deficient, and therefore, guess what? We're retaining water. We can't dump things because, once again, we don't have the proper nutrients, especially sodium, in there. So this concept of not having that reducing salt intake is destroying it. Is absolutely destroying. See, what they're trying to do in their concept, just like diuretics, which is one of the main medications giving for blood pressure that way, they're trying to lower the blood volume. They're trying to drop the blood volume that way. And they're saying, well, sodium is holding water. That's not true. It doesn't work that way, okay? And then they give this dumb concept too. They'll say, lower sodium, but actually increase your potassium. Guys, you understand that every transaction in every cell takes potassium and sodium, okay? Actually, a more dominant sodium. Okay, so the idea is the fact that it's like when we have reduced sodium levels, real salt, our body can't exchange water, it can't exchange nutrients without that sodium potassium pump. This concept that you need less salt is destroying people's health, and it's making their blood pressure go up. So you heard it right here. Once again, Dr. Andrew McGuire has an amazing quick tip on there. Go back and look at our quick tips. Actually, it's kind of cool. He teaches it right at our seminar that way, and it's kind of beautiful actually watching how the biochemistry and physiology works. See, it's kind of neat. Nobody really disagrees with anything we say. Do you know why? We back everything up with biochemistry. We back everything up with physiology. It's just that you've been told since you were little, no salt, no salt, no salt, reduce your sodium, by docs that don't even know how it works. By docs that don't even understand that blood pressure is a normal response to any stressor. Instead of finding the stressors, and one of your major stressors, you don't have enough salt. You don't have enough salt. It creates major biochemical reactions, especially in the angiotensin aspect that way. Now, it's kind of funny. Medical science knows this. So what they do, instead of giving a person salt, they give them an angiotensin medication. This one they keep you on for life. Salt is very cheap. You don't need a doc. Guys, it's a big, crazy business out there. Once again, need more salt. You'd be surprised how much salt we're not getting per day. Actually, it's kind of funny. It's interesting. It's quite amazing. You know, we got hunting season coming up here in a little bit. Okay, obviously it's bow season stuff right now. But one of the things is this, an animal is attracted to salt very quickly because vegetables don't have a lot of salt. That's why you can put a salt block out there to attract them. Every animal on the planet needs high levels of salt. It's just that we don't get it in most of our foods that way. And so we run towards things in adding salt, but most of our salt that we add today is very processed chemical aspect that way. Once again, and Dr. Andrew Brandon posted that video, they could see it that way. So yes, and at the bottom here, what does it say? Stress. Do you saying stress? Well, of course. That's one of the major aspects that way. All right. Now let's go back to our thing here. So salt, we need it more. Okay. So what do I do now? Number one, stop listening to people that are going to put you on blood pressure medication the rest of your life. They're absolutely clueless. Yes, give this video to your doctor. He doesn't know what he's talking about when it comes to blood pressure. Okay. The idea is this. Now, if your blood pressure is elevated, once again, you need to find out what your normal is. Now, and let's go through this. I always tell people, the way blood pressure is done, for example, it's not even clinically done right. All right? When you actually have your blood pressure done, you need to rest a minimal of 5 minutes. Actually, you should rest at about 15. Okay? You need to be resting, and you actually need to have your arm and your actually heart at the same level. Also, this is not a joke. I find this funny because you can even see it on some medical commercials that way. Do you understand, if you just cross your legs, if all you do is cross your legs, it's well documented in research to show you that your blood pressure will go up while you're doing your blood pressure. Not a joke, okay? Now, once again, so when you start to take your blood pressure, you always want to take it first lying down, then sitting up, and then standing. Because once again, you'll be able to tell if the systolic, the pressure and the contraction from the heart, or the diastolic, which actually is supposed to be whatever pressure we have in the artery itself that way, you can determine which one is actually one of the major culprits. See, I kind of find it funny. Somebody will have 120 over 90, and guess what happens? We need to put them on medication because we got to reduce that pressure in there. But then people go, but then when they do that, 120 goes low, so it reduces your heart contraction, and therefore you end up very fatigued. Okay? Vice versa, somebody could be 140 over 70, and guess what happens? They're like, we're going to give you a medication this, and what it does, it affects the other one at a much negative rate. The systolic and diastolic, and here's something you'll never hear, should never be counted together. They're two separate values. They actually, for example, have very dramatic difference of what's going on that way. You say, because if you look at it this way, one's based on heart contraction, one's based on the blood vessels that way. Actually, that's why people say the diastolic, the 80 is a little bit more important. Well, sure, I don't disagree with that. But what happens is, as a doctor, then it should be investigated to see why that value itself is actually abnormal. They should never be looked at together. 120 over 80 is a fallacy in leading people to actually taking medication that they may not need at all. Because once again, I may run out of this room and my blood pressure may jump to 160 over 80, and they will look and go, Doc, you need high blood pressure medication. You're at 160. Well, why don't you ask me what I just did? I just went for a run. You would say, so therefore my blood pressure is going to be up. And see, they totally disregard the other number that way. See, the one thing is this. The one question that the Wellness Way docs have done so well and why our clinical results are so amazing is we always ask the question, why? If you know that the body adapts to a stress, we're going, why? Where's the stressor? What's it doing? What can we do? The current thinking is, you're going to end up with a stroke. If you ever talk about blood pressure, the number one thing you are programmed to think of is stroke. It is very rare for a person under the age of 40 to have a stroke with high blood pressure. It's very rare. Okay? I'm not saying it doesn't happen, and one of you guys may say, my brother died at 25 of it that way. Well, then guess what? I'm going to say, listen, he didn't die from high blood pressure. He actually had some weak arterial system that he either beat up. Once again, that's why he's football players. You're saying you got to be careful because you can actually really damage blood vessels by physical trauma that way. And then guess what? All of a sudden, that's why you see some males at a young age do it. I would say, what kind of sports do they play? Because you can damage the smallest blood vessels in your head and in your body, which is in your head, and you get hit in the head, and all of a sudden your blood pressure jumps up. There's a stroke. See, one of the major causes of stroke today, One of the major causes of stroke today is actually aspirin. When they said do a baby aspirin a day because it thins your blood and it affects your blood pressure, what they forget to tell you is it thins your blood vessels, causes damage, and you're more susceptible to stroke. So in the 80s, when that baby aspirin a day came out, it caused stroke to go to a high level, and it made people more scared. Do you understand? The thing that they said that you should fear the most, they created most of it by saying a baby aspirin a day. Do you know that baby aspirin a day, introduced in the 80s, for example, has led to more strokes than blood pressure ever would? Because it's thinned more blood vessels, mainly the ones in your brain, which are your smallest capillaries, and it causes damage. Look at all the scientific research. See, them not understand the body. I mean, I know as I gotten older now, I've actually been a little bit more directly calling them out on what they're doing. Their idea of how they take care of the body is actually ludicrous. It's why, once again, it's why no matter what country you go to, I don't care if it's universal health care or if it's private insurance, the thinking perpetuates all places across the United States and the world, and that's why we continue to get more sick and more sick and more sick about what's going on that way. So what do? First of all, find a person that thinks differently. Number two, they're going to really reduce your inflammatory responses. Guys, get your inflammation tested. There's great markers of CRP, ESR, other lab values, fibrinogen, that's going to actually really help you figure out what you're going to do that way. Get tested first. That's always the key. Get your food allergies done. See where other inflammatory markers are coming from that way. Those things are going to really guide you, reduce inflammation, and keep your whole arterial system very strong. See, plaquing itself, which is a whole other topic, first has to come with arterial damage. Inflammation is the key thing that does it that way. Now, see, what people do is that now the natural method has jumped in and actually stepped in with a little different things. So, doc, well, eat a lot of magnesium-based foods and potassium-based foods and things like that. Well, yeah, you could do some magnesium and relax some of the vessels, but you didn't reduce the stressors. You didn't reduce the inflammation. And actually, the funny part is, Brandon, what's the number one magnesium-based food that you can eat? Chocolate. You got it right. Dark chocolate. Dark chocolate is great for your vessels. Not processed Hershey's chocolate, your good organic dark chocolate, because once again, high magnesium. But you gotta understand, you're still reacting to the stressors. You're still trying to relax the stress, okay? Find the stressors, that's a big key, okay? And once again, one of the biggest keys that's causing stress to our body is actually low salt. Do you know what I'm saying? Now, does mental stress contribute to it greatly? Yes, it does. There is no doubt, okay? So if you have inflammation and actually massive stress, over time, just like Mayo Clinic said, over time, come on. Over time, guess what? You keep that high, eventually something bad's gonna happen. But blood pressure is nothing more. Blood pressure is nothing more than a warning. Blood pressure is nothing more than say, listen, my body's adapting to the stress. Any doctor that tries to lower your blood pressure immediately is a ridiculous doctor. They do not know what they're doing, okay? Now, once again, people freak out when they say, but doc, you have a stroke. You've been conditioned to think that way because you can reduce your blood pressure. If you want to, you can reduce it naturally at some things right away and stuff like that, which I'm not a fan of because, once again, you're just relaxing the blood vessels or slowing the heart down that way. But you want to do is this. Find a doc to reduce your inflammation and reduce the stressors. Then over time, what you'll now see is the blood pressure start to go normal. I have done it personally for over 20 years. Our doctors all over the country have done it that way, okay? And it's really funny. And you guys watch it right now, and all of a sudden you're like, doc, I'm on blood pressure medication. Yeah, stop it right now, and what happens to you? Your blood pressure goes right up where it was before, because why? Your body's still inflamed, your body's still stressed out, and I don't care if you're eating chocolate or taking every natural thing on the planet, what's gonna happen is that stress will continue in your body, and there'll be some more bad things that are gonna happen. And yeah, then eventually a person leads to a stroke. A stroke does not directly cause by high blood pressure. There's a lot of damage that has to come before you can even have a stroke. And some of the things that they're doing to you right now will lead you to it, including a baby aspirin and reducing your blood pressure, because number one, it doesn't give you the ability to find out your body's starting to reduce the stress because you're already artificially lowering the blood pressure, what leads to you think everything is normal. Common does not mean normal. My name is Dr. Patrick Flynn. What we're going to do now is we're going to pull our winner for the Dutch test. Okay? Come on over here, Brandon. So what we're going to do is I'm going to pull this one, wait, put it up high so I can't see any names that way so everybody see it. So we're just going to pull a name. We're going to move it around here a little bit that way. Let's see who the Dutch test winner is. Josie Verkoelen? All right, Josie Verkoelen. You will actually win the Dutch test this morning. Josie, if you are on, please private message me and we'll get your address and we'll send you out the test kit that way. You just won a $350 test. Yes, guys, do me a favor. If you believe what we're doing, and I hope you even get a little mad when sometimes I speak because I want you to get mad because you know something I tell people. I'm also saddened every day where it seems like sometimes I come off mad because people come in every day. You know, I was here in Green Bay. I'm in the Green Bay office right now in our studio. I actually listened to a new patient just cry to our doc, just so sick. Young lady, 37 years old, list of medications like this. And our doctors say, there's nothing more that you can do. No, that's how they think. She actually was crying like crazy. And Durham, I saw her medication list. She was on high blood pressure medication. She was on birth control. She was on a lot of other medications, including steroids. She's been on antibiotics like crazy. And this is what's happening out there. It's devastating that way. So I tell people, I say, Doc, you know, you're not ever trying to sell anything. You know, I could have actually taught you about blood pressure and actually had some chocolate and some other things that way and said, here, buy our stuff. Doesn't do anything, guys. That's why the whole natural method and everybody buying stuff on the internet like crazy drives me nuts. That's why I give away most stuff, because I want you to understand that Josie's life, for example, if she hasn't anything done before, this is going to change the direction of her life. I promise you it will, because just a simple test like this will give me an idea of what her body is doing and how to get it back to normal, because your body will always adapt to the stresses so you can survive. Don't cover up the adaptations. Find out what's stressing on your body. God bless all you guys. I appreciate you always watching and listen how I think. You guys have a wonderful day.